It's the easiest thing in the world to do, and we ought to do it more often. It's simply what I tell patients to do is to use both of their hands, reach around the scrotum, and actually take the testes, supporting it with 2 fingers in the back and the thumbs in the front, and roll the testes between your fingers and feel it. It's an ovoid mass, the testes. It's oval in shape. And it rolls much like an Easter egg would roll, so that it's easy to feel. It's easy to, by rolling it back and forth and feeling along the margins of it, you can feel for any firmness. A testicle should feel like a hard-boiled egg, but in that it has, you can squeeze it and it gives you back a little bit, pushes back against you. If you feel a hard spot or a spot that's very tender, then that may be cause for you to see a doctor. In addition, what you need to be able to segregate out is the epididymis, which is the top part of the testis that is involved in the maturation process of sperm. And that's generally superior and behind the testicle, or posterior as we say it. And you'll know it when you feel it because it's a cord-like structure and it's very sensitive to pressure, so you don't want to hurt yourself. You don't have to clamp down on your testicle to feel a subtle change. Young men are always, for whatever reason, in that region of their body. Either they're adjusting themselves or they're more or less checking themselves just to make sure everything's where it needs to be. So I always tell my kids, and I tell young men that come into my office, when you're there, spend an extra minute or 2 and just check yourself over. It really is a very simple procedure. It shouldn't take any more than a minute or 2 to do when you become comfortable doing it.